Hi YouTube. Sorry, I keep trying to make this video and I keep getting distracted. This is my second video. It's a follow-up to my first, where I just generally talked about surgery in the Dominican Republic, mommy makeovers, Brazilian butt lifts, and things like that, and the reasons why people go to the Dominican Republic for surgery versus the United States. And a lot with a large misconception that cost is the main driving factor, which I don't think is the case in most people I've spoken to. So this video is, I talked about results in my last video a lot, and people might think if you go for plastic surgery, you're going to get results, and they'll probably be, something you're happier with than what you had before. And that's probably true to a degree. But what I was really referencing, I'll go back to the beginning. So for me, this, it seems abrupt to people because they didn't know it's something I've always wanted to do, but a lot of circumstances in my life came together that made it like a really good time for me personally to go. I got married, and my husband had to go back to the United Kingdom because we have to wait for him to get his green card. So I have some time that's just like a good time to do it. It would be less convenient when he's here. It's the summer, it's slower at work, although there's always work to do. So factors like that kind of made it like just a better time for me to consider this. So I went on my first consultation. The first doctor I saw was in Babylon. And he was very nice, but he seemed to think that he wasn't really as interested in the types of results that I was. We didn't really talk about my goals, but he showed me his work, and there was no alignment. He showed me pictures of female bodybuilders who looked good, for the way that they looked, but that's not my goal at all. So I really left kind of feeling like, is this all there is? Is this what I'm going to, have to choose? And then I went to another consultation, and that one was not bad. Again, it was a nice doctor, but I just kind of felt depersonalized there. It's kind of like I was an object, not a person. So I left that consult, and I was kind of like, oh, well, I don't really know what to do. None of these doctors seem to really be, to have the same kind of aesthetic that I do, and I don't know how I could communicate that to a doctor. And I researched, and I saw a lot of people who did have an aesthetic like me, and they all were going to the Dominican Republic. And one thing you do when you're researching and trying to pick a surgeon is you look through pictures, and you read reviews on sites like Real Self and stuff. So I did that, and I quickly started to notice the major difference between the surgeries in the Dominican Republic and the surgeries here. And I have a very suboptimal method of illustrating this to you, which is my phone, and I'm going to try to do it better because this is like my second video. So I'm scrolling back through the pictures, and there was a lot of reflection last time. So I took some screenshots, and I'll start with this one, which is kind of basic, and it's just, and it's kind of slanted, sorry, but as you can see, the woman had a tummy tuck. It looks good, but, there's no real difference in her shape. Another one where a woman had a tummy tuck, definitely an improvement, but, again, no real difference in her shape. Same deal here. This is a Fleur tummy tuck, I believe. She looks good, but not very tight, not very sculpted, which is, it's still probably something that makes her happy, and people are comfortable with this, and they don't want to travel, and that's fine. And this is the one that I said I thought was the quintessential American-style tummy tuck. There's what you might call improvement. Everything is kind of straightened out. She may feel more comfortable in bikini now, but she's just straight up and down the sides. There's no curvature to her waist, and that's not really what I was looking for. So these are the types of pictures that surgeons showed me when I had consultations here. Okay, now this is a woman who I've seen this YouTube video. She's on YouTube, and that's a Dominican surgeon's patient. I'm not sure which surgeon, but immediately you can see the difference. This is a patient of Dr. Cabral's. This picture is on Pinterest and stuff like that a lot. And it looks a little more dramatic, I think, because of camera angles. But as you can see, it's a different style of surgery entirely. Another very dark picture of a Cabral patient, but you can see how her waist is narrower and her hips are wider, which I'll get into in a minute. And sorry, there's semi-nudity here. Another patient in the Dominican Republic, before and after the sides are reversed, but you can see the difference. That's a patient of Dr. Malal's, and even with clothes on, you can see that I'm talking about. And this one I saw today on Instagram, and I thought it was a great example of why women go for surgery. It is dramatic. It may not be the type of result everybody wants, but you know, it looks really good, and it's just a complete difference. If you go back to here, you can see possibly why somebody might choose to go to the Dominican Republic for surgery. So that's really kind of where my decision making came from. And I said that I would go back to, I can't remember now, but there was something in the pictures that I said I would go back to. But I think American aesthetic values, up until very recently, have very largely hinged on thinness and being thin. And, you know, the thinner the better. Whereas in the Dominican Republic, it looks like, you know, curviness is more of a value. And, you know, curvy is a word that's controversial because some people say that it means, you know, having curves. Some people think it means overweight. But I'm talking about actual curvature. And, you know, that was really the deciding factor for me because I was so impressed by the outcomes that I saw. I'm just going to flip through my pictures really quickly and see if I can remember what it was that I wanted to say. No, I can't remember. But, yeah, that was the deciding factor for me. And I don't actually remember kind of going through the which surgeon do I pick stage, because I know I see that a lot. People like all the pictures, they can't choose because, you know, so many surgeons have so many different areas of talent, and they're just amazing. But for me, I was looking for doctors that work with plus-size patients, and Dr. Lima comes up a lot for Dominican Republic surgeons. But I was immediately drawn by his universally positive reviews. The results that I've seen in plastic surgery groups where people share personal pictures, personal testimonies from patients of his versus some of the other doctors. And I don't want to, you know, rag on any doctors who seem to be a little more conveyor belt. You know, some of them gave really dramatic results, but it seemed like the experience was not as peaceful and not as, I don't want to say safe, but, you know, there would probably be some harrowing moments in it, so it really wasn't a decision for me. And, like I said, I spoke with some plastic surgeons here, and they weren't terrible interactions, but I got in contact with Dr. Lima on Friday night by email. Saturday morning very early, I texted him, he gave me his number, I texted him, and we talked back and forth a bit, and then I texted Janet, and immediately we were able to arrange, you know, she looked at my pictures, she looked at my stats, she gave me a surgical plan that was different than the one I was looking for, and I was really pleased with it, and she gave me a quote. We picked a date, and this all happened between like 8 a.m. and 8:30 on a Saturday, so I mean, there are dolls who wait weeks for a callback, and I was just so, I felt so, like I wouldn't fall through the cracks, like, you know, this surgeon and, his coordinator cared about their patients, even if I wasn't a patient yet, so that really made my decision. And, you know, going over time, I see a lot of dolls changing their doctors. You know, they get so impressed by one doctor's work, they left a deposit one place, they go to another place. Some dolls change it while they're there in the Dominican Republic. And I've never felt drawn to another surgeon, even when I see that they have really amazing results, because Dr. Lima's results are also just amazing. And everybody, on a daily basis, I see other dolls saying that, he changed their lives, he gave them their lives back. And those are, you may say, oh, well, that's just external stuff, but you really don't understand what it's like for people who experience these major changes, and how life-changing it can be to wear certain clothes that you might not have been able to wear. So I definitely understand where they're coming from. But I wanted to really illustrate, because this comes up on Real Self a lot in the doctor's questions and answers. And they get really cute sometimes. And I can tell, I know the difference between nonsense and not nonsense. And I can tell when doctors are BSing these girls who don't know, who are asking the questions. Like, a lot of girls will ask about the blue pill, which is part of the surgery experience there. Everybody gets, it's called Versed here. It's called Dormicum there, but it's what they use in sedation dentistry, and you get that before surgery so you relax. And it's not as common here, I would guess, or not used because the surgery and anesthesia are different, which might be a different video. But girls will ask what it is, and doctors will imply that it's something weird and scary that they should be afraid of, and nobody knows what it is, when it's actually a very common medication in the United States. And things like that I don't like to see. I mean, just be honest. Don't, try to trick people who are going to you for quasi-medical advice. So, things like that really get on my nerves. But I can't remember why I was talking about the blue pill. But yeah, so results, it's not about saving money, and it's not about, going to a doctor in another country and it being a risk. It's, there's a lot of research involved. There's a lot of feeling comfortable with your surgeon. And the reason why most people pick their surgeon is because of results and comfort, and just knowing you have to live with the outcome that you get. I mean, dolls go for second and third rounds, and that's, I hope that I don't have to. I'm sure that if I really enjoy my experience, I'll want to go back, but they enjoy their results, and they kind of want to get some other things done, or whatever the case is. But the point that I'm making is surgery is a bit more permanent than a haircut or, hair color. It's a result you have to live with. So, when people say, I don't understand why women go to the Dominican Republic for surgery, I think a lot of it has to do with the fact that you have to live with that result. You have to live with that, the way you look. And when you see the pictures of, patients in the Dominican Republic, and you think, I want that, it doesn't seem like as big or as scary of a deal to travel, especially since a lot of people are going to Miami anyway, and it's basically the same deal. You go down there for 10 days, you stay in a recovery house, there are lots of surgeons, they have specials, so you're not going to spend very much less, if any less at all, in the Dominican Republic than you do in Miami, and it's roughly the same. So like I said in my other video, people who are just looking or price shopping doctors would go to Miami probably before they would go to the Dominican Republic. The Dominican Republic is really for people who specifically want, perhaps it's cultural or it's just a preference, they just want a specific shape. I know for me, my personal aesthetic is kind of pin-up-y and retro, and there are lots of retro clothes that I can wear, but I'd like to wear them better. So, things like that, those factor into my decision, because if I'm going to do it, I want to do it right. So, this video went on a lot longer than I intended for it to, and I just wanted to go into that a little bit. So, if you have any questions, if you want me to address something else in a future video or a vlog, or if you have any, if there's anything that I can help you with or find out for you, just drop me a comment. You can tweet me at Kim LaCapria on Twitter, and thank you for watching. Bye.